Assalamualaikum. I'm coming with another video which is on tracheal tumors. Trachea, as compared to other body organ, has less intensity for the tumors, and the benign tumors are very less than 6%, while most of are, if they occur, they are the malignants. Malignants mean they spread from one side to another side. They are called also metastatic disease. And the tumors, which is the most common, which are located in that trachea, I will go on. I will tell you about which one is most common, is the rare. But the common one are the squamous cell carcinoma and adenine cystic carcinoma. These are the very common tumors. While the tumor categorized according to the tissue or type of cell. So, if a origin from the glands, bronchial glands, it's called adenine cystic carcinoma, mucoepidermoid carcinoma, and pleomorphic carcinoma. If it's origin from the squamous cells, which is most common in smokers, because the trachea lined by the pseudo-ciliated colonal epithelial cells, but after the smoking, the metaplasia occur, in which the cell tissue change from columnar to the squamous type, and mucociliary function loss here. So the secretion or sputum of this patient remove or clear by the coughing only. So they don't have this function of spontaneously clearing the sputum. So the squamous are the one of the squamous cell carcinoma, and another the squamous papilloma. Squamous papilloma only occur in the trachea, while squamous cell carcinoma occur in different part of the body. Then neuroendocrine tumor. The neuroendocrine tumor, which is are the typical and atypical carcinoid tumor. Atypical are pre-malignant and goes to the malignant condition, while another the tumors are the small and large cell carcinoma. These are the malignant tumors. Then for the mesenchymal cells, the tumors are the chondroma. It's again benign tumor. Chondroblastoma also is benign tumor. Chondrosarcoma, it is the malignant one. Glioma, this is benign tumor of the smooth cells, and leiomyosarcoma. So this is the malignant. So the most common are the adenine cystic carcinoma and squamous cell carcinoma. But adenine cystic carcinoma, it is slow in progress, while squamous cell carcinoma highly invasive and spread distant site. So the investigation, again the lung function test, in which the inspiratory phase is the flatten, while another the CT scan, which give the extent of disease, also extratracheal tumor that compressing the trachea, and other bodies distant tumors. And after that, bronchoscopy. So in bronchoscopy, the endoscopist tell the location of disease and take biopsy. If it's possible, then they do laser resection or smear removal of the tumor. And maybe if the patient is not candidate for surgery, then they will do stenting, which is palliation for the that tumor. Patient always present with cough, dyspnea, and uh, somehow that hemoptysis. Hemoptysis always occur in the squamous cell carcinoma and carcinoid tumors. So another investigation, MRI. So it's better focus on CT scan and 3D reconstruction of CT scan. Then if there is a tumor and you have not done any resection biopsy, so you go directly for the resection if it's a localized disease. And for preoperatively, always stop the steroids before the surgery, oral or IV. Control the diabetes, because most of the patient being treated for the asthma, while the patient never have such a disease. So the physician always diagnose them as a adult asthma. Another this uh, never try to give radiation if you are treating a patient. First go for the surgery, then go for the adjuvant surgery. So neoadjuvant therapy here is contraindicated, and this tumor never responds to the chemotherapy. Only the squamous cell carcinoma and that bronchogenic tumors. And after that, go for the, if the tumor is resectable, go for the resection in anastomosis. And after resection in anastomosis, if the margin is positive, then give radiotherapy. The dose is between the 66 to 70 grays, and they give 4 centimeter above and 4 centimeter below of that tumor site. But never give radiotherapy immediately. Always wait 6 to 8 week of post-operatively. And these are the tumor adenine cystic carcinoma is progress, so it has a good prognosis. And if the margin is clear, so there's a 34% of 5-year survival, while the benign tumors have 100% survival and with no recurrence. So tracheal tumor are basically need concentration, that if it's malignant and irresectable, then go for the stenting. Never use that expandable stents. And also there's some other therapies like laser therapy, microwave therapy, ablation therapy, cartridge or cryotherapy. These are also considered when there's a palliation for the surgery to remove that tumor. Thank you.